Good afternoon. I'm Mandy Cohen. I'm Secretary of the North Carolina Department of Health and Human Services. And this afternoon, I'm joined by Director of Emergency Management Mike Sprayberry, Monica McGee, and Karen Magoon are our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish interpreters. As far as today's numbers, as of this morning, there were 10,028 new cases reported today. Sorry, that's 10,028 new cases reported today. There are currently 3,960 people hospitalized right now across North Carolina. And sadly now there have been 7,328 deaths. In the 10 months that we've been fighting this pandemic, this is the most worried that I've been for our state. We continue to set new records. We reported over 10,000 cases yesterday and again today. Our tests that are positive remain in the double digits. And most worrisome, every day we see new record highs of people hospitalized with COVID-19 and record high of those needing intensive care. Many hospitals have stopped non-urgent procedures to free up staff or have opened additional COVID units. The situation is so critical that last week the federal government said that if you are with people that you don't live with, you should assume you've become infected with COVID and you're a danger to others. Earlier this week, I issued my first ever secretarial directive with immediate actions for North Carolinians to take to save lives and slow the spread of this virus. It calls on North Carolinians to stay home. You should only leave home for essential activities such as going to work or school, for health care, to care for family members, or to buy food. If you're over 65 or at high risk for developing serious illness, use delivery services or an alternative pickup method for food and retail. Do not gather with people that do not live with you. Do not go to another person's home indoors, and do not have others over your home indoors. When you do leave home for essential activities, always wear a mask and keep distance from people. Given the level of viral spread, there is a high risk that you could have COVID right now and don't know it. I know this is hard. We will get through it. We now even have more research that shows that the 3 W's work. Remember those 3 W's. Wear a mask anytime you're with people you don't live with, wait apart from others, and wash your hands often. And we have a new tool to combat this virus. It's our vaccines. We are working hard to get vaccines out to people as fast as possible. Our local health departments and hospitals have been ramping up quickly, putting their vaccine plans to work. Already, more than 180,000 doses have been given, and in the last 24 hours alone, 20,000 shots went into arms. We're hearing from our vaccine partners that they are anxious for more doses. The state is also implementing its vaccine plan. We are moving forward with facilitating large vaccination events starting next week, and we continue to onboard additional vaccine providers, starting with our federally qualified health centers. Director Sprayberry will share how emergency management is supporting North Carolina's vaccine operational effort, particularly how they're supporting our local health departments who have been around the clock in around-the-clock pandemic response for close to a year now. Remember, vaccine supplies are very limited. While some people want to be first in line to get their shot, we knew going into this that others have very legitimate reasons to be hesitant about the vaccine. Understandably, communities who have faced long-standing and continuing racial and ethnic injustices in our healthcare system and broader society may feel greater distrust towards vaccines. All vaccine providers have the responsibility to ensure equitable access to vaccines, which means that they take intentional actions to reach and engage historically marginalized communities. We are partnering with trusted community leaders and organizations to provide accurate information to all North Carolinians. And we need your help. As you share information with the public, please share these important facts. First, scientists had a head start. These vaccines were built upon years of work to develop vaccines for similar viruses. Like all vaccines, they were rigorously tested for safety and effectiveness. More than 70,000 people volunteered in clinical trials for the 2 vaccines to make sure they were safe and worked to prevent COVID-19. There were no serious safety concerns noted in the clinical trials, and to date, the vaccines are 95% effective in preventing COVID-19. You cannot get COVID-19 from the vaccine. You may have temporary reactions like a sore arm, headache, or feeling tired and achy for a day or 2 after receiving the vaccine. I will be rolling up my sleeve to get my shot as soon as it's my turn. You can get accurate information about vaccines from our website, yourspot.nc.gov. You can also find contact information there for local vaccine providers. It will take many months to vaccinate everyone who wants it. Keep practicing the 3 W's, wear a mask, wait 6 feet apart, wash your hands, until everyone has gotten a chance to get vaccinated. And with that, I'll turn it over to Director Sprayberry for a few remarks.
Thank you, Secretary Cohen, and thank you for your continued outstanding leadership. You are appreciated. Good afternoon, everyone. Today is day 305 of the State Emergency Response Team activation for the COVID-19 response. First, an update on the winter weather our state is experiencing. Snow has been falling in the western counties, and several inches have accumulated in some areas. Boone and Asheville have seen the most snowfall so far, with 4 to 5 inches and more incoming. Hazardous travel conditions are expected across much of western North Carolina well into the weekend. Our great partners in the Highway Patrol and the Department of Transportation are out working hard to keep the roads clear and open. There are no major traffic incidents or power outages to report at this time. We have deployed resources to 2 known highway hotspots where vehicles often get stranded during winter weather. Those are the Turner Grade on Interstate 77 in Surry County and the steep grade on Interstate 40 near Old Fort in McDowell County, the gateway to the mountains. These resources include personnel and equipment from the Highway Patrol, NCDOT, and the North Carolina National Guard, including heavy wreckers that can help quickly free up vehicles that are stuck. This strategy works to keep these important interstates open. If you're in an area with significant snowfall, it's best to stay off the roads unless you absolutely must travel. This will help the DOT and local crews clear the roads quickly. If you must travel, slow down, increase following distance, and travel carefully, using your lights and wipers. As always, you can visit drivenc.gov for the latest on road conditions and closed roads. This winter weather reminds us of how important it is to have a family emergency plan for all hazards. Everyone is encouraged to go to readync.org to build their own custom plan. Being prepared is so important. Special thanks to Seth, a 17-year-old from Cary who mailed us some important information on preparedness so we can enhance our operation here at the State EOC. We're continuing to support our outstanding partners at the Department of Health and Human Services through the statewide vaccination effort. Daily interagency planning is ongoing to support vaccination operations. This includes our local partners. The first National Guard teams to support vaccination will be reporting early next week to serve in Forsyth County and with Albemarle Regional Health Services, a public health agency that serves 8 counties in northeastern North Carolina. Additional teams from the National Guard are currently being assembled and will be deployed based on the local needs of our county partners. The National Guard is supporting this vaccine mission while continuing its work supporting food banks and rapid COVID testing sites across the state during the pandemic. Our NCEM logistics team continues to support DHHS in the distribution of personnel protective equipment statewide. We're also supporting hospitals in their med-surg efforts to accommodate increasing numbers of patients. Emergency supplies of dry ice are in place at our warehouses in Tarboro and Baden. This dry ice can be requested by hospitals, health departments, or medical providers if they're at critical risk of losing valuable vaccine due to loss of ultra-cold storage or unable to obtain dry ice through normal purchasing methods. Let me encourage everyone to get the vaccine when your turn comes. It's safe and it's free. I'll be rolling up my sleeve to get the shot when it's my turn. In addition to the 3 W's, our best chance to end this pandemic is for most of the population to receive the vaccine. You have a spot, so take your shot. A special thanks to all of our local health departments, hospitals, healthcare systems, and local emergency management agencies for your outstanding work and partnership. As my battle buddy, Dr. Mandy Cohen says, it's more critical than ever to observe the 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. With kindness and cooperation, we will all get through this together as one team, one mission, and one family. Thank you, Madam Secretary.
Thank you, Director. I appreciate you and your team as well. It's been a tremendous partnership over almost a year at this point. And with that, we will open and take your questions.
Do you have any idea when the state will have enough vaccines where regular people will be able to get it? And what are your thoughts about the amount of vaccines you've gotten so far, and how has that been going as far as the distribution? Thank you.
Thanks, Steve. We know that vaccine is in limited supply. Right now, we have been vaccinating our healthcare workers who work directly with COVID patients, folks in our long-term care facilities, both the workers and the residents. And now, just this week, we've started to move on to those who are above the age of 75. Our next group will be those who are our frontline essential workers, meaning those workers who have to go in person to work. And it is hard for them to be physically distant in that work. Our police officers, our child care workers. And we have that prioritization to make sure that we can protect those who are at the highest risk of death and dying. That's why we went to our nursing homes and long-term care, our most vulnerable. But it's also why we wanted to think about those who are at highest risk of exposure, which is why we vaccinated our healthcare workers first. And as we move forward, we'll be working to vaccinate those frontline essential workers like our police, firefighters, child care workers. Right now, we are working very quickly to get the vaccine that we have been allocated by the federal government into arms. As a state, we have allocated all of that vaccine out to our vaccine providers, and they have been working very hard over the last, it's only been 2-3 weeks that we are into this, but they've been ramping up, particularly since we've started 2021. They've really ramped up their efforts and really proud of them embracing that sense of urgency that we all feel to get vaccine into folks as quickly as possible. Now, as far as when it will be available for anyone who wants it, I think, as we've been saying all along, I think it's going to be well into the spring, maybe the late spring, until we have enough vaccine available to anyone who wants it at any point. So we're going to keep working to get the vaccine that we get from the federal government out to folks as quickly as possible. It's why we're supporting our local partners, our health departments, our hospitals, now our FQHCs, in their work in getting a vaccine as quickly as possible. I want to thank our National Guard partners and our emergency management partners that are continuing to support these efforts as we all work together here in North Carolina. Thanks, Steve.
Our next question is from Rose Hogan with North Carolina Health News.
Hi, Secretary Cohen. Thank you very much for taking our call today. I think like other reporters, we've been inundated with questions from readers about when they can get their vaccines. So even though it's good to have some clarification about that it's going to take some time, there are some basic questions like, here's one. can people get a vaccination in a county that's not their home county?
Great. Thanks, Rose. Great question. So, yes, you can get a vaccine even if it's not in your home county. Now, we always encourage folks to call close to home first and start there. But no, you don't have to stay in your county, particularly depending on where your home is located. It may be quicker to go to another county or to your local hospital that might be closer, but maybe right over the border of the county. So you can show up in any county, though we'd encourage folks to call their local departments of health first. We have prioritized trying to get this vaccine and an access point in all 100 counties, right? That was a priority for us here in North Carolina to make sure there were access points in every single county so that folks who didn't have the ability to drive too far could get an access point in their county. But you could show up at any site and get a vaccine, assuming that you are meeting the prioritization requirement. And remember, we're still at healthcare workers who work directly with COVID patients, our long-term care folks, either the workers or the residents. And now we have opened to those who are over 75 years old of age, so 75 or older. So those are the groups that we are vaccinating right now.
Thank you. I have a follow-up.
Great. Thanks, Rose. Go ahead.
Okay, I have a follow-up. So then the next thing is, what's the logjam in, getting vaccines to the state? Is it that the manufacturers aren't manufacturing as fast as earlier predicted? Is it a holdup on the federal side? Is it getting it out to counties? Is it county capacity? Because, we've spoken to a number of counties where they just don't have a lot of capacity, and so they're not doing a lot. And finally, if the National Guard folks will be going to Forsyth County, but what about getting them to smaller counties that really have a shortage of personnel? And I'll stop being like Brian, and I will ask some more.
Thanks, Rose. Well, let me start with the latter half, which is how are we supporting our local partners to do this? And as Director Sprayberry mentioned, these are partners that have been running hard for almost a year responding to this pandemic, and we at the state want to make sure we're supporting them. So our partners in emergency management are partnering with our local health departments. And what we've asked is any of our local health departments need any support, any kind of staffing needs, whether that's back office help to even do data entry, to do the vaccines themselves. They just need to raise their hand and ask, and we have the ability to mobilize staff to various counties depending on what they need. So folks just need to raise their hand, use the same process that we go through if we're in a hurricane, to use that request process. We're using staffing support such as those who have been doing our contact tracing, and we are mobilizing them and redeploying them as we need to support folks. In addition, there have been wonderful offers of volunteer help across the board, particularly for vaccinators. There have been a lot of folks who have raised their hand to say we can be vaccinators, which is wonderful. So our team has been coordinating with those folks who have volunteered to match them up with where the need is. And I think that's why you're seeing the rate of vaccine going into arms has really picked up now that we're out of the holiday time and we're able to sort of do that support for our local partners. Things have really sped up. And I think you're going to continue to see that pace continue to accelerate. As far as the overall allocation that we get from the federal government, that I think is questions better answered for them. They are making the determination at the federal level how much vaccine we get at the state. Then our job is to get that out to our providers as quickly as possible, which we have done, and then for our providers to get those vaccine into arms. So I think we're working along all of the different pieces of this logistics chain, if you will. Look, everyone's working hard, feel that sense of urgency of wanting to get vaccines out as quickly as possible, and we've been ramping up work. Let me see, Director, anything to add? Nope, he's good. All right, thanks, Rose.
Our next question is from Vanessa Rufus with WCNC-TV, Charlotte.
Hi, Happy New Year, and
Happy New Year.
thank you for taking my question. We recently just had a field hospital open up in our area in Lenore. And I wanted to know if you knew of any other plans to build field hospitals anywhere else. And also, if you could explain maybe what the process is into getting a field hospital, or maybe how the decision is made to put a field hospital in a certain location, and when that actually will be done. Like, when a hospital reaches a certain capacity, we're going to send a field hospital out there.
Vanessa, thanks for that question. So a couple of things. Yes, a field hospital is now open. And I mean, I think it is very much recognizing the fact that our hospitals are under strain, that they needed to set up a new facility to add some additional capacity in order to be able to respond to COVID. That opened yesterday. They have patients there right now. And that is really a local decision. They came to us saying, we want to open that field hospital. We think that is the solution that will help us here amongst these counties and these hospital systems. And then at the state, we've worked very hard to make sure that they have all of the regulatory and safety things that they need to have in place in order to open a facility like that, right? In order to operate at a level that can offer the medical support and the safety that it needs to do. So we work closely with them once the local teams on the ground said that is the solution that we think is going to make most sense for us. So there's not a direct trigger necessarily to say, if this is happening, we're going to build a field hospital. For them, that was the right solution. A lot of other places in the state, we have a lot of ability to surge our hospital capacity within the walls of the hospitals themselves, so we don't have to go outside of them. Often the rate limiting step, or the most precious commodity for us, is people resources, our talented doctors and nurses and respiratory techs and others. And so the physical space is often not the limiter. So what we have been working to make sure we can do with our hospital partners is have good visibility. Do they have the staffing that they need? Are we able to move patients around if one hospital starts to get overloaded? And can we all share the workload? And what I would say is there's been fantastic collaboration across the state, and I think that comes after a year of hard work to be in the place to be able to respond like this. So that was the right decision for the communities to build that field hospital, not necessarily a trigger in all places. I think every region and partnership will make different decisions, and from us at the state, we just want to support them in those decisions. Anything else you would like to add? Okay, thank you. Thanks, Vanessa.
Yeah, go ahead, Vanessa.
Okay, so obviously we've been seeing the numbers really taking off, I would say through the fall and into the winter as we get here into the new year as well, of course. I mean, and I feel like the numbers have been growing like they've never grown before. I mean, is there anything else at play other than people letting their guards down, getting together? Maybe they're not wearing masks. Do you think maybe we have this new variant here in North Carolina, or is there something else that you're seeing playing a factor into this large growth?
Yeah, Vanessa, it's a great question. I think some of it starts with the fact of the way this virus spreads. It's called exponential growth, meaning as once you start to increase, you actually accelerate that rate of increase. It's not a it's not a linear acceleration. It's an exponential, which means it gets faster and faster as you get more and more. And I think that is what we are seeing, number one. Second, I do think that folks have had a long year, and I get that. They are tired. They want life to go back to pre-pandemic. And I think sometimes we are letting down our guard, particularly around the holidays. I know there was a lot of holiday travel. We saw it in pictures at our airlines and such. So we know there was holiday travel. We know that these increased cases are linked to the fact that folks are getting together indoors and not wearing their mask. And that's why I issued the secretarial directive this week to be extremely clear about what folks should not do. They need to be staying home unless they are conducting essential business, unless you're going to work or school, getting groceries. You should not be going to someone else's home indoors. You should not be having people over to your home indoors. So those are the things that I think are happening. Now, as far as the variant, it is possible that that variant is here. And in fact, it it is likely, and we are operating as if it was here. Now, it has not been identified here, and this is the variant that was first identified in the United Kingdom as being more contagious. It has been identified in a number of states across the United States. Here, it's why we are operating as if it's already here, and that we need to realize that this virus was contagious before and now is even more contagious as we go forward. So I think it is all of these things together, which is why we have to be particularly vigilant as we move through the next number of months. Thank you.
Our next question is from Ben Sessoms with the News and Observer.
Thank you for taking my question this afternoon, Dr. Cohen. So ICU capacity has decreased over the last few weeks, and North Carolina just saw its second day in a row with new cases reported at over 10,000. Other parts of the country have seen their ICU capacity hit zero. Do you see that happening here if the spread isn't mitigated in the next few weeks? Also, as you were talking about earlier with the field hospital that's been set up in Western North Carolina, is there a discussion about activating the state medical shelter in Hamlet?
Ben, thanks for that question. As far as ICU capacity, yes, I do expect for us to see further strain on that capacity. Now, to date, we've been able to manage that in a number of ways. First, I know that our hospital systems are not doing some of their non-urgent procedures that could result in needing to use more hospital beds, and even just the staff. So some of the staff that can work and do in the surgical area could now be moved over to handle ICU level patients. So right, it's also managing physical space, but for ICU care in particular, it's making sure we have the doctors and nurses that know how to give that higher level of intensive care unit kinds of care. That is what we've been able to manage well, I think. So folks are decreasing some of their non-urgent procedures. They are also putting 2 patients in a room, for example, so that they can manage their staff better as well as manage equipment and infection control. So we're trying to manage in that way and conserve space and staff resources. And then I think we are converting space over and opening additional ICU beds. Again, that requires the staffing to do that, but that's what we're working through to make sure that folks have that capacity to expand if they need it. So we are going to manage this hour to hour, day to day with our hospital partners as we go through this. And as far as the Hamlet area, as I was saying, physical space tends not to be our problem in most areas, but we have that Hamlet space in case we need to activate it, and we do need more physical space, but as of right now, we do not have plans to put that into action right this moment. Anything else, Director? Okay.
Ready.
It's ready, he says. Thank you.
Our final question today will be a follow-up from Ben Sessoms at the News and Observer.
Thank you for taking my follow-up, Dr. Cohen. So is North Carolina concerned at all about the CVS Walgreens partnership regarding vaccinations of long-term care staff and residents? As of Tuesday, that partnership had received 166,000 vaccine doses and given out 13,000 of those. Does the state have any indication that has picked up this week?
Thanks for that question. I think a couple of things with the CVS Walgreens partnership. Again, that is a program run by the federal government, and it was our decision to turn on that program. And when we do, we are required to allocate some of our doses to that program. We felt it was important to do, given the high-risk nature of our vulnerable populations in nursing homes and others. And so we did allocate those doses. I will say that we are not yet getting the direct data from the CVS and Walgreens program to the state. It goes to the federal government first because, again, it is a federal program, but we are hoping to see more of that data so we can better understand, and I can better answer your question, Ben, about how things are going there, because we do see the fact that we aren't seeing the kind of numbers that I think they were hoping for either in the first week, and we're not sure, is that data lag or what is happening. So first we need to see the data. Second, we are hearing anecdotal reports of more vaccine hesitancy in our long-term care workforce. And it's why we have spent a long time thinking about how to partner with folks in our long-term care settings, with those who are in historically marginalized populations, to make sure we are getting good information out to folks so that they feel confident about taking the vaccine when it is their turn. So I think we still need to tease through all of this, but I think it's important for all of us to make sure we're getting out good information about the vaccine, that it is safe, it's effective, it's been tested, you can't get COVID from it. I think those are really key important messages that everyone needs to see. I think you're going to see even more public service announcements from us, more materials to make sure that folks can get good information about this vaccine and make decisions. So I think there's first issue is getting transparency from the data of what's going on with the CVS and Walgreens program, and then addressing any vaccine hesitancy that might be happening amongst our long-term care workers so that they can feel comfortable taking the vaccine when it is offered to them. Okay, I think that was our last question for today. I want to thank everyone for joining us for the second press conference of the week. Happy New Year to everybody, and we'll be back next week with more. Thank you.